And in the unit 9, we are left only with the last chapter, that is 9.8, epidemiological anthropology. Can we proceed? Okay. So, complete concentration since the beginning, please. Don't miss first few points. Right. So, first of all, what is epidemiology? What is epidemiological anthropology? Let us first understand what is epidemiology. So, James Throssell defined epidemiology as the study of distribution and determinants of diseases. Is it clear? Epidemiology studies about two things. What are the two things that epidemiology deal with? Yes, all of you? Distribution and determinants. Okay, very good. Can you tell me, what do you mean by determinants? What do you mean by determinants? Not symptoms. Not symptoms. Agents of diseases. Determinants means what causes the diseases. Is it clear? What causes the diseases? Is it clear? Factors we can say, causes we can say. Okay. So what causes diseases? Like say for example, malnutrition can cause disease, agreed? Malnutrition, pathogens, some genes, lethal genes. Okay. So determinants can be some lethal genes or nutritional deficiency or some pathogens like virus, bacteria, fungi, etc. Okay, so right now the determinant is COVID-19, isn't it? SARS-CoV-2, that is the presently talked about determinant. And distribution means what? Okay, distribution means, first answer this question. Okay, I will ask you a series of questions, keep answering them. First question, X-linked dominant diseases are more common in males or females? X-linked dominant diseases are more common in males or, because you have only two answers, you are just typing MRF, right? You did not even give a small thought about it. You didn't even try to, most of you did not even try to recollect it. How males, I hope you remember this, X capital A, X capital A, X capital A, X small a, X small a, X small a. These are the three types of females. Males can be X capital A Y or X small a Y. So it means only 50% deceased. Here 75% deceased. So X-linked dominant disease caused by capital A is more common in the case of males or females. Those who said males simply thought that M या F type करूंगी मैं. Okay, so होगा, और 50% it will be correct. That's it. Please don't take it so serious, so easily. Okay, give it a thought. सोच के बताओ. Done. X-linked recessive diseases are more common in बबेजा देखो, and question भी नहीं सुना. Males. Earlier I said females, na? This is males. Okay, earlier females, so this is males. Huh. X-linked recessive diseases are more common in, Manisha, X-linked recessive diseases are more common in 50, males 50, females 25, isn't it? Males 50, females 25. Okay, Babeja agreed, you know the answer. Okay, convinced. और बोलने का जरूरत नहीं है. Okay, fine. Okay, then Y-linked diseases occur only in. Y-linked diseases occur only in. Okay, then occupational diseases, that is diseases that occur due to the work. Occupational diseases are more common in males or females? Males. Okay. And okay. Bone related, skeletal system related, bones related diseases are more common in males or females? Why? Because of two reasons. One is calcium deficiency. Because say, for example, lactation process. In the lactation process, a lot of calcium goes to the baby, isn't it? From the woman's body, a lot of calcium goes to the baby. During the childbirth also, let us suppose if the baby is having some 302 bones, all the bones in the baby's body are formed by taking calcium from the mother's body only, isn't it? So childbirth, menstruation, lactation, because of this, there is a lot of body's calcium going out. So calcium deficiency leads to bone-related problems like osteoporosis and all. Plus, okay, estrogen, progesterone, okay, deficiency, that is decreased levels of these hormones during menopause. Okay, decreased amounts of these hormones during menopause. Actually, we need these hormones to absorb calcium. Calcium को absorb करने के लिए ये hormones चाहिए. So if these hormones level decreases, then we cannot absorb calcium. That is the reason why if a woman is suffering from osteoporosis, give her 1 liter milk every day, it doesn't help. Okay, bones cannot heal because bones are not absorbing the calcium, because absorb करने के लिए हमें estrogen progesterone चाहिए. Is it clear? Plus yes, your point is also correct. Okay, vitamin D deficiency is also more common in the females because males are more into the work. Okay, so there is a more chance that they are more exposed to the sun. Even today also, when compared to females, males are more in the workforce. Even today also, is it clear? So is it clear? So bones related diseases like osteoporosis, etc. Then, okay, one more question. That Ellis-Van-Creveld syndrome is more common among. This is memory-based question. What you studied earlier. Ellis-Van-Creveld syndrome is more common among others. Others, please, everybody. Amish migrants to Pennsylvania. Okay, very, very good. Amish migrants to Pennsylvania. Sickle cell anemia, thalassemia, HBC, HBE, okay, and glucose 6-phosphate dehydrogenase deficiency. All these blood-related diseases are more common among. So it means distribution over, isn't it? Till now, what we have done is about distribution only. Okay, it means what? Some diseases are, okay, how they are distributed. It means how the diseases are distributed. Some diseases are more common in males, some are more common in females, some occur only in the males, some occur only, for example, if you take uterus cancer, males cannot get this, only females. Prostate cancer, females cannot get this, only males. So kind of only male, only female, or more common in males, more common in females, or geographic distribution. For example, all that thalassemia, sickle cell anemia, glucose 6-phosphate dehydrogenase deficiency, HBC, HBE, all those things, they are more common in Africa, Mediterranean Sea, etc. Isn't it? Okay. So geographic distribution we have, sex distribution we have. Okay, tell me, nutritional deficiency diseases are more common among rich or poor? Nutritional deficiency diseases are more common among, it means economic distribution among economic groups, ethnic groups also. Some diseases like, say, for example, Amish people, that's an ethnic group, isn't it? That is one ethnic group. Caste distribution, religion distribution. So this is about distribution. Determinants is about causes. Now you got some idea about what is epidemiology, study of distribution and determinants of diseases and the reasons behind the distribution, like biological, social, cultural. Why the diseases are distributed like that? For example, okay, why X-linked dominant diseases are more common among females? That is because of biological. Okay, and like, say, for example, if you say why like this one, why vitamin D deficiency, why it is more common among females? That is social and cultural, because culturally men go out into the, why occupational diseases are more common among the males, social and cultural. So what could be the reason behind such a distribution pattern? Why the diseases are, how the diseases are distributed and why the diseases are distributed like that? When you question yourself why the diseases are distributed like that, you will get 3 types of reasons: biological or social or cultural. So this is how we can define, okay, epidemiological anthropology. But of course, what we have discussed till now, we will go into the details systematically. I was just discussing with you. We are just in the titles, so don't worry. I'm not saying 9.8 completed. Okay, so I'm not saying that. We'll discuss about it in detail. Okay, so we are still only in the titles. So got some idea. And epidemiological anthropology also roughly the same meaning. Okay, there is no much difference between these two words. This elucidates. Elucidates means, lucid means what? Clear. Elucidate means makes it clear. Okay, it explains something like that. It elucidates. Etiological. Etiological means what? Causing or contributing to a disease. Etiological factors means causing factors. Is it clear? Like determinants, isn't it? So here etiological factors, look at here. Here etiological factors is equal to here determinants. Fine. Okay, involved in a disease incidence, and emphasis on population variation. Population variation is related to, okay, distribution. I will highlight this in the red color. So, okay, observe those circles. Population variation is equal to distribution there. Determinants is equal to etiological factors here. So it means both the definitions are roughly the same. So it means we are going to study about 2 things. In our discussion, actually, according to the schedule, 2 classes. I don't know if you cooperate, if the class goes in a good pace, don't know. We may be able to complete today also. Okay, let us see how it proceeds. But okay, 1 to 2 days topic this is. Throughout this class, or maybe even in the next class, we will be discussing only about these 2 things: distribution, determinants. Is it clear? So these are the 2 keywords in our today's and tomorrow's class: distribution, determinants. Okay, titles over. So let us start the movie, right? So first thing, sex. You know this already. We completed this. If there are anybody new in this course, this is a topic that we have already completed. So we are just, okay, recollecting the thing. I'm not explaining it right now. Okay, they are dealt in detail in the earlier classes. So now coming to this, okay, some diseases occur only in the males. Example, Y-linked disorders, prostate cancer, etc. Clear? Okay, keep responding so that I can proceed fast. Then, some diseases are more common in the males. Did you notice the difference between the first and the second point? In the first point, only males, not more common in the males. Only males. Females cannot get this. Second point, females also can get this, but more common in the males. Yes. Okay, so some diseases are more common in the males. Example, X-linked recessive disorders like hemophilia. Okay, plus heart diseases, stress-related, work-related. This is a kind of okay, work-related or stress-related. Statistics clearly indicate that males suffer more from the heart problems. Is it clear? Then lung cancer could be due to the smoking or due to the occupational hazards. Okay, lung cancer is either due to the smoking or due to, and again, I'm not saying that this is not possible in females. Okay, females also smoke. Okay, so then, and other occupational diseases, they are more common in the males. It's not that it's not possible in the females, possible in females also, but more common in the males. Next, same way, ovarian cancer, endometriosis, ovarian cancer, cancer to ovaries. Ovaries are the primary reproductive organs of females, so only females. Endometriosis, endometrium is inner lining of the uterus. Endometrium means inner lining of uterus. Okay, inner lining of the uterus. So uterus only females, so only females. And other diseases of female reproductive system occur only in the women. Same way, arthritis, osteoporosis, and other skeletal system related problems are more common in the females, as reason is also okay, as explained here. Is it clear? Because of these three reasons. Because of three reasons. Okay, one is calcium deficiency. Second one is low levels of estrogen, progesterone. Thank you, Priya. Thank you so much. Okay, so coming to this, here I'll give you in the brackets estrogen and progesterone needed for absorption of calcium. Is it clear? That is the reason why during menopause, I will also write this word more clearly. During menopause, menopause means the time when the menstruation stops. Okay, the women do not get periods anymore. During menopause, estrogen progesterone levels decreases. They are needed for the absorption of calcium. So calcium absorption will decrease. Same way, vitamin D deficiency. These are the three reasons why osteoporosis or arthritis or bone related diseases. Okay. So because of these reasons, they are more common in the females. Done? Can we proceed? Is this clear for all of you? Here also vitamin D needed for absorption of calcium. Okay, so that is the reason for that. You can go through this later. So this slide is clear. This is distribution based on the sex. Okay, and one important technique in answer writing which you people are forgetting or taking it easy is use as many subheadings as possible. Because every time you keep a subheading and underline it and do something like that, human tendency is the examiner will see what is there in the new subheading. Isme kya hai? Okay, if you write everything also, don't expect that they will read word by word everything. It's not possible. Humanly, it is not possible. So at a glance, what you have written should be visible. So use as many subheadings as possible. Yes. Okay, Sarthak, yes. And also if you observe the age distribution, these are the diseases which occur in 40s, 50s, isn't it? A disease can be distributed based on age groups also. For example, nutritional deficiency diseases can be more common in the young age. Okay, so different like Alzheimer's, Parkinson's are more common in the old age, like 80s, 70s, isn't it? Huntington's disease, Alzheimer's, Parkinson's, very old age. These diseases, menopausal age, 50s and all. Okay, that is age distribution. Okay, so sex over. Next, age. Nutritional deficiency diseases are more common among the children. Okay, and here if you want, you can write examples. Like say, for example, vitamin D deficiency can lead to rickets. Rickets. Vitamin C deficiency can lead to scurvy. Is it clear? Vitamin deficiency diseases. Any two examples you can write. Is it clear? And how do we know the examples? I think either I have given it here or I have given the vitamins table in. I have given vitamins table in nutritional anthropology unit 12. Okay, do you remember unit 12 syllabus? In the unit 12, you have nutritional anthropology. There I have given vitamins table. Okay, why? Because nutritional anthropology, vitamins are very important part in the nutrition. So I have given the table there. But in the table, you will also have nutritional deficiency diseases. Nutritional deficiency, therefore it comes under unit 12, nutritional anthropology. Deficiency, okay, I mean to say, look at here. Nutritional deficiency diseases. Deficiency causes diseases, right? So it's a topic in 9.8. And deficiency of what is causing the diseases? Nutrients, right? So this is also a topic of unit 12, nutritional anthropology. Is it clear? So not only vitamins, everything related to nutrition, okay, comes under both the topics. Okay, please make a note of it. Question came this year also. Epidemiology question also came, I think. Okay, I will discuss this year questions also. And by chance, if I forget, you can remind me. Okay. For example, yesterday, like I forgot to keep the question, but I have written it in which topic races. Okay, that is race concept valid? I forgot to add it in the PPT, but I have written it. At least that we can do. Is it clear if I forget? So I think from epidemiology also a question came this year. I'll check it once. So is it clear why nutrition is a topic in both? Okay. And why nutritional deficiency diseases are more common among the children? Because children need nutrition for growth. And adults, growth completed. We need nutrition only to maintain. Is it clear? We don't have to grow further. We don't have to grow our bones. Our bone size is not increasing. Is it clear? Okay. So therefore, nutrition is more important in the childhood. Sometimes, like our friends also, if you observe, some people take a very good care of the nutrition. They eat only healthy. They never eat outside. If they eat outside also, instead of burger, please order me a Subway. Such people. But they frequently fall sick. Why? Probably childhood nutrition was not good. Is it clear? By the time they realized the importance of nutrition, okay, the important age is gone, something like that. So nutrition is more important in the childhood because that is formative stage. Is it clear? Then, okay, same way. Degenerative diseases like Alzheimer's and Parkinson's are more common in the old age. You can also write Huntington's disease if you want. Huntington's disease is also very common among the old age. Clear? Or you can also write menopausal age, osteoporosis. Is it clear? Here, if you want like examples, you can write vitamin C, scurvy, vitamin D, rickets. Clear for all of you? Can we proceed? Then geographic. Sickle cell anemia and malaria, that is Plasmodium falciparum, are more prevalent in sub-Saharan Africa, parts of India, etc. And if you want to highlight it more, you can take the content from 9.6. Okay. If you want to elaborate on this, because I just told you sub-Saharan Africa, parts of India, but there I have given Greece, Italy, Mediterranean Sea, like that I have given the distribution more in detail. So you can take the places from 9.6 if you want. Okay. Then respiratory infections are more common among the cold countries, isn't it? Even like say, for example, in America, every year they keep taking the flu shots. And annually, many lakhs of people, millions of people are dying due to flu. Okay, now leave about COVID-19. But usually also every year also annually, many lakhs of people are dying in USA due to the flu. And they keep taking flu shots. Did you hear about it? And the allergies are very common there. Allergies are very common there. Okay. So, ठीक है, अभी सुन लीजिए. Flu is very common in America annually every year. Okay. So annually every year, some lakhs of people are dying due to flu, and they keep taking every year. They keep taking flu shots, flu vaccines. Shots means booster doses. Every year booster they have to do. Is it clear? Maybe our situation also will be like that in future. Okay, because of the COVID-19, we also keep taking the shots, not those shots, vaccine shots every year. Okay. So, but already in cold countries, the situation is like that. Okay, respiratory infections are more common in cold countries. Is it clear? Okay. Yes, next socio-economic groups. Okay, next distribution is among socio-economic groups. Natural deficiency, first of all, nutritional deficiency diseases due to lack of access to good quality food, and infectious diseases due to unhygienic conditions and lack of education. Okay, are more common among lower socio-economic strata, isn't it? First thing, nutritional deficiency diseases are more common among the lower socio-economic strata. Why? Because of lack of access of good quality of food. And infectious diseases are also more common. Why? Due to unhygienic conditions, maybe contaminated water. See, for example, presently, like the pandemic is going on, we are hiding ourselves properly in the home. But what about the street people? Okay, even during the lockdown, they have to stay on the streets only. Is it clear? They don't have, say, for example, pollution in Delhi, then they will give holidays. We all hide ourselves in the rooms. But what about the street people? Even when the pollution is at peaks, they have to stay on the streets only. Okay, so unhygienic and poor quality water, contaminated food. Okay, you can even observe the people taking the food from the garbages and eating. So contaminated food, contaminated water. Okay, so because of that, lack of hygienic conditions plus lack of education. Education, what is the relation? See, for example, with education, you will get awareness about cause, isn't it? For example, if you know that chikungunya, dengue are caused because of malaria, even if you are poor, at least you can try to have a mosquito net at least, isn't it? Okay, so you can try to protect yourself. Or say, for example, if you know that cholera comes due to water contamination, then if you don't have access to some mineral water or purified water, at least you can boil the water and drink. Is it clear? So it means you know the cause, then there is a chance that you can protect from that. Okay, so due to unhygienic conditions and lack of education, the infectious diseases are also more common among the lower socioeconomic strata. And you can give examples. For example, nutritional deficiency diseases. Examples I have given here, same examples. Or if you want, you can write some two other examples. You can write any other example, or you can write one example there, one example here. Okay. Then infectious diseases, same thing. You can write about malaria, cholera, They're more common among the people of lower socioeconomic strata, isn't it? And about examples of nutritional deficiency diseases, don't worry, you will get more examples in this chapter also, plus you will study more in detail in nutritional anthropology unit 12 also. So there is no deficiency of content for nutritional deficiency diseases. You will get enough content on that. Fine. So with this determinants over, okay, now let us see about distribution. But of course, we are going to see more about determinants also again later. For the time being, okay, we have done something about distribution. Okay, now we are going to see, okay, the types of diseases based on the distribution. Is it clear? We completed distribution. I'm sorry, we completed distribution as of now, right? Now let us see types of diseases based on distribution. Again, these days everybody knows this. Endemic diseases, diseases that exist permanently in a particular region or a population. For example, malaria is a constant worry in parts of Africa. Is it clear? Endemic disease, clear? And also you might have studied in the newspapers that, okay, we are waiting for the time when the COVID-19 becomes endemic. COVID-19 still did not become endemic, unfortunately. Okay, abhi endemic nahi bana, but we are waiting for that good days, okay, that it may become endemic in our populations. So in the beginning, we had a hope of like totally eradicating it. Now we understood that it is not going to go anywhere. It is going to stay with us. We have to learn living with the SARS-CoV-2. Okay, now at least we are little optimistic that we are waiting for the good days that it will become endemic at least. If a disease gets endemic, it will not have such waves and all, third wave, second wave, such waves will not be there. Constantly, few people will keep getting the diseases. Like occasionally, sometimes we get malaria, occasionally, sometimes we get dengue, so such diseases. So that is endemic. Is it clear? Constant worry. Okay, few people will keep getting it. Okay, then now epidemic. Okay, epidemic means outbreaks. Okay, an outbreak of disease. Outbreak means what? Short duration, many people will get sick. That is called epidemic. Clear for all of you? Then a global epidemic is a pandemic, like flu. Yes. Okay, like different types of flus. Okay. No, plague was a pandemic. Plague was pandemic. COVID is a pandemic. Okay. Plague, COVID. Okay, they are pandemics, right? So this is about the distribution. So like I told you that throughout this 9.8 chapter, we are going to study about two things: distribution, determinants. We now completed distribution. Is it clear? Distribution among sex groups, distribution among age groups, distribution among geographic groups. Okay, but actually you can write more examples. You can write that Ellis-Van-Creveld syndrome. You can write that total rod cell color blindness. Total rod cell color blindness. Okay, you can write about thalassemia. So you know many more examples you can write about it. Geographic is over. Socioeconomic groups examples are over. And types of diseases based on distribution also we have completed. So can I say that distribution is over among the two terms? First factor is completed. Next one, determinants. Determinants means what I told you, causes. What causes the disease? Okay, factors that influence or cause. Factors that influence or cause or determinants. The determinants of diseases can be social, biological, isn't it? We can have social causes. For example, like if you observe the socioeconomic groups, this is a social cause. They are getting the nutritional deficiency disease because they are poor. Okay, they are getting more infectious diseases because they are poor. So we have social causes for it. Is it clear? Plus, like we have biological factors also, like genes, etc. Done? Clear? Can we proceed? Okay, next, social determinants. Okay, so wherever you have to write some list of points like social determinants 1 2 3 4 5 6 7 8. Instead of that, you can show like this. It looks good in the answer. Okay, some of you are already doing this, others also. Social determinants, healthcare access, isn't it? Few people do not have access to healthcare. Next, psychological factors. Psychological factors. Psychological factors, something like, say, for example, like about food only, like say for example what like vegetarianism, non-vegetarianism, like or something related to that. Is it clear? But as such, that can be kept in the religion also. Next, income, socioeconomic strata, work stress also you can consider. Income, that is socioeconomic strata, infectious diseases, nutritional deficiency diseases, individual behavior, COVID-19. Okay, 2 gaj ki duri, mask hai zaruri, like that, not taking the vaccinations, not following the COVID protocol, all these things, individual behavior. Next, neighborhood, community. Okay, in which community you are living. Is it clear? Then family factors. Family factors, like these are mostly neighborhood, community, family factors. This is also related to food habits. This is more related to food habits, like nutritional deficiency diseases, etc. Okay. Next, occupation, occupational diseases, occupation, because you are getting the disease because of your job, because of your occupation. Then education, how education can cause disease. Say, for example, education lead to urbanization, then urban pollution and all. Okay, like negative effect. First negative effect. Positive effect, awareness. Okay, from education you can take two branches. Positive effect is awareness. Okay, awareness, good economic situations, etc. Next, say negative effect is kind of urbanization, like maybe like some technical education. Okay, leading to some like occupational diseases, etc. Lack of education is also education only. Okay, lack of education or education. I mean positive and negative sides of it. Lifestyle diseases also. Okay, then transportation, that is like transportation, you can write about globalization. Because of globalization, increased transportation, what happens is there is a chance that every epidemic can become a pandemic, isn't it? Somewhere in Africa, the Omicron variant came within days, like it swept off the world. Why? Because of transportation. Okay, so these are some social diseases. Okay, social determinants of diseases. Can we proceed? I repeat. Okay, we understood that epidemiological anthropology is about distribution and determinants. To some extent, we completed distribution and then we started determinants. In the determinants, we understood that we have primarily two types of determinants: social determinants, biological determinants. Social determinants we discussed and we have seen a flowchart about it. So can we proceed? Next, biological determinants. Biological determinants are substances that enter the body from external environment. It can be pathogens or poisonous substances or nutritional deficiency, isn't it? So whatever nutrients we have to receive, if they are not coming into our body, then also disease. If a pathogen comes into our body, then also disease. Like say for example, silicosis, asbestosis, like that, any poisonous substances, pollutants, carcinogens enter into our body, then also disease. So these are not kind of social pathogens, all these things. Is it clear? Or, okay, so like a biological factor need not always come from outside, isn't it? It can be existing in the body also, like genetic diseases, hormonal diseases, etc. Lethal gene is not coming from outside. You are born with it, isn't it? So biological factors can be two types: those which are coming from outside, those which are existing in our body. Those which are existing in our body, examples, genes, hormones. Those which are coming from outside, examples, pathogens, poisonous substances, nutritional deficiency, etc. Okay, depending on these criteria, diseases can be classified as. Let us see that. Okay, see, point is about epidemiological anthropology. You can use a lot of knowledge from the earlier classes, isn't it? This is not directly only from this class. This is kind of a summary about all these things we studied earlier. Okay, next. So, diseases depending on biological factors, diseases can be classified into two types, isn't it? Okay, social factors over. We completed that in the flowchart. After social factors, biological factors. Depending on biological factors, diseases are two types. First one, congenital. Do you remember the meaning of the word congenital? I told you in the chromosomal aberrations class. By birth. Is there a rule that should it be genetic? Is there a rule that it should be genetic? No need. Okay. Can it be genetic? Can it be genetic? Yes. Okay. Then congenital diseases which we have by birth, like this, like existing in our body. Is it clear? Okay. Or second one, coming from outside, external environment, acquired. We are getting it. Is it clear? From inside and coming from outside, acquired. Then acquired diseases are again two types. Okay, acquired diseases are two types. First one, communicable or infectious diseases. Okay, if you get it by pathogen, the pathogen can go from your body to another body. So it means it is communicable or infectious. Okay, then if you work in an asbestos mine and if you get a disease called asbestosis, okay, will you transmit this disease to the other person? So those are non-communicable, non-infectious. Non-communicable, non-infectious. If you smoke and if you get lung cancer, will you pass it on to the next another person? Inheritance is different. Okay, is it infectious? If a person sits beside you, he will get lung cancer from you. No. Okay, so like that, acquired diseases are two types: communicable or infectious, non-communicable or non-infectious. Is it clear? Depending on biological factors, diseases are congenital, acquired. Acquired are again two types: communicable, non-communicable. Can we proceed? Okay. Next, now we are going to see some details. Okay, in these details, you should be able to place them in any one of these. Like say, for example, nutritional. Okay, here I have given nutritional deficiency diseases. Okay, now place nutritional deficiency diseases in any one of them. Say 1, 2A, B, 2A, 2B. Yes, 1, 2, 2A, 2B. 2B, acquired, non-communicable. Okay, like that. So, okay, what I have given till now is not the total scenario. Like for example, like nutritional deficiency diseases. Earlier, I did not give examples. I have only written handwriting. I have written 2 examples, right? Here you will get more examples of that. Okay, you should be able to keep these examples in a suitable place. Is it clear? For example, okay, if you are writing about distribution, okay, you can write this in the age distribution or lower socio-economic strata. Is it clear? Okay, so I repeat, if you are writing for distribution, you have to write this for, okay, lower socio-economic strata, okay, plus children. Okay, and if you are writing this particular content for cause, then you will write that it comes under 2B. Is it clear? So this is how we are going into the details. Okay, now in the nutritional deficiency diseases, and one important thing, 9.8 is important for prelims also. 9.8 is important for prelims. Nutritional anthropology is also important for prelims. Okay, so okay, extra concentration, and because here there is nothing much to understand, divert all your focus to by hearting this. Okay, learn the content. Focus your concentration on learning it. So in the nutritional deficiency diseases like protein deficiency, this leads to inferior growth, swelling of the face, discoloration of hair and diarrhea. These are the symptoms when you get protein deficiency. Is it clear? Next, carbohydrate deficiency makes a person lean and thin. The person remains tired and weak because of carbohydrate deficiency. Clear for all of you? Can we proceed? Vitamin deficiency. Vitamin A deficiency leads to night blindness. B1 deficiency leads to beriberi. Beriberi symptom is weak muscles. Vitamin C deficiency leads to scurvy. Scurvy symptom is spongy and bleeding gums. Right? Vitamin D deficiency leads to rickets, and rickets symptom is soft and brittle bones. Isn't it? Next, mineral deficiency diseases. Not only vitamins, we also have some essential minerals. We have to definitely consume them. Iron deficiency leads to anemia and weakness. Iodine deficiency leads to goiter. Goiter is swelling the swollen glands of the neck. Here the glands, thyroid gland, near the thyroid gland, it looks swollen. Weight loss, etc. That is goiter. Clear till now? Calcium deficiency, decay of bones and teeth. Decay of bones and teeth. Okay. So next one, occupational and work-related diseases. 2 questions. If you are writing this for distribution, tell me such diseases are more common in which group? Okay. Males and working class. Males and working class. Very good. Okay, you can add working class also. Okay, and if you are writing that for cause, if you are writing the occupational diseases for cause, okay, so where can you keep it? Where can you keep it? Communicable or non-communicable? Non-communicable, like that. Okay, so occupational or work-related diseases. Okay, now listen carefully, complete focus here. Occupational disease is any disease contracted primarily as a result of exposure to risk factors arising from the work activity. Work-related diseases have multiple causes. Work environment play a role. Okay, for example, it means what I'm trying to explain here is there is a difference between occupational diseases and work-related diseases. I'll give you a small example. Due to stress, if somebody got heart problem, due to stress, if somebody got heart problem or high BP, is it work-related or occupational? It is work-related. It means there can be many reasons where work is only one reason. There can be many reasons where work is only one reason. Okay. If you get asbestosis because of working in asbestos mine, then occupational. It means if you do not work in asbestos mine, you will not get it. Is it clear? Okay. Silicosis, asbestosis. Okay. Black lung disease because of working in coal mines. So these you will get only because of the work. Work is not one among the multiple reasons. That is the difference between occupational diseases, work-related diseases. Clear? Then, okay. Now, asbestosis among asbestos miners, black lung among coal miners, silicosis miners and quarrying and tunnel operators, silicosis among quarrying and tunnel operators, okay. Bicyanosis among workers in the cotton textile industry, those who work in the cotton, okay, cotton, because they inhale cotton fibers. So cotton fibers accumulate in the lungs. Bicyanosis. Occupational asthma can be because of any of these. It can be because of bicyanosis, silicosis, by black lung. Any of them can cause asthma, that is work-related asthma. Dust, anything. Occupational, dust means not, dust, pollen, grain do not come under occupational asthma, because anybody can get it. Is it clear? That's what I'm saying. Okay, because of asbestosis, bicyanosis, etc., you can get asthma also. Is it clear? Because when all those things accumulate in the lungs, obviously it can lead to asthma. Okay, this list is occupational diseases or work-related diseases. This list is what? occupational, and it is 2B, isn't it? 2B, it comes under 2B, and common among males and working class, common among males and working class. Next, same way, okay, carpal tunnel syndrome. Carpal tunnel syndrome, okay, memorize the name. Due to compression of median nerve, the major nerve in the upper limb, a nerve that originate here and extend till here. Is it clear? Major nerve in the upper limb, okay, is it clear? So that will undergo compression. Why that will undergo compression? Because of working in this position, typing, okay. So such work, software professionals can get this disease more commonly. Is it clear? Because constantly working in this position, okay. So due to compression of median nerve, the major nerve in the upper limb, among persons who work in poultry industry, information technology, etc. Poultry industry, because they keep collecting the eggs like this. Poultry industry, like everybody who work in this position. Is it clear? Next, computer vision syndrome. Among persons using information technology for hours. Lead poisoning, affecting workers in many industries that processed or employed lead or lead compounds. Clear? So most of these are occupational diseases. Okay, can we proceed? Next, genetic diseases. Okay, genetic diseases. If you are studying about distribution, then that X-linked, dominant, X-linked, recessive, Y-linked, that point. Is it clear? Male-female distribution. And okay, if you are studying it for cause, then is it congenital or acquired? Is it congenital or acquired? Congenital. You have that gene by birth. You have that gene by birth. Sometimes, though the symptoms are exhibited later, the gene is present by birth. For example, you may have the gene for diabetes by birth, but you may get diabetes symptoms at the age of 40. Gene to hai when you are taking the birth. Huntington's also, gene is there, but it may express later. But you are born with the gene. You are obviously you are not getting genes in between, right? Mother will not keep getting like every year birthday one parcel of genes gift. Okay, nahi mil rahe na. Is it clear? So whatever genes mother is supposed to give, ek hi bar dete hain, isn't it? Okay, so obviously we are born with the gene. Any genetic disease, you are born with the gene. If you have the disease, whenever it will express, different diseases express at different ages. So this comes under congenital. So can you write genetic for distribution and cause both? Then, and should I give you the examples? We have studied so many examples in 9.4 chromosome aberrations, 9.3, 9.2 pedigree analysis, lethal genes. Do you remember all of them? So you have to take examples from that. Can you? So I have given the checklist from where you have to take content for this. Okay, and this one is only you can write for cause. Distribution wise, we cannot say, like Down syndrome is more common. We cannot say like that. Okay, in this population, it is more common. Only one point is if mother's age increases during pregnancy, there is a high chance of chromosomal aberrations. That also, that can be due to women education. So like that also you can write. So can we proceed? Next, autoimmune diseases. Okay, autoimmune diseases. Autoimmune means earlier many times I told you that we always produce antibodies to foreign antigens and we never produce, or we should not produce antibodies to self antigens, isn't it? At least we should not produce antibodies to self antigens. But sometimes by mistake we produce antibodies to self antigens. I hope you remember that story. Okay, that is all nucleated cells have MHC1 self antigens are presented in MHC1. Is it clear? Then T cells will see them and they will realize that, okay, these are our own antigens, we should not destroy them. Feel familiar? Okay. So like that, okay. As the process goes, we should not get, okay, we should not produce antibodies to self antigens, but sometimes. Let us suppose if the MHC1 fails to present some self antigen, एक self antigen अंदर बच गया, present नहीं हुआ, okay, then the immune system cannot recognize it. So sometimes errors do occur in this. Clear? Error, okay. So it means some self-antigens are not familiar to our immune system and our immune system can produce antibodies to it. Then obviously it will cause diseases, because if I produce, let us suppose if I produce an antibody, okay, to like my own insulin producing cells, then what happens? I'll suffer from the disease. Okay, so such diseases are called as autoimmune diseases. When you are immune to your own self, then we get these diseases. Clear? When we are immune to our own antigens, when we produce antibodies to our own. Let me give you an example. First of all, distribution wise, nothing much, but one reason can be stress. But with stress, let me tell you something. Okay, if the doctors do not understand any other reason, then one reason they say is stress. Okay, for some hormone imbalance, something happens. Okay, why? You are taking stress, right? Okay, ले रहे हो ना, तो इसीलिए. Is it clear? So stress किसको नहीं होता? Everybody is stressed. Okay, so that can be a universal reason that can be attributed to every disease. Is it clear? But we don't know. Sometimes, like some people will take more stress, still they are very healthy. Some people, they're very cool, okay, cool people, but they will feel they have more hormonal imbalances or they have more stress related diseases. We observe this, isn't it? So we don't understand what is the exact reason. But itna complicated bhi nahi hai, because genes also play a role, right? Nature plus nurture. It's not only how you take care of your body. It's also about with what genes you are born. Is it clear? Okay. So don't know the reason. The reason that the name that we have given is stress. Means actually we don't know the reason for autoimmune diseases. They are random. Randomly, some people will get autoimmune diseases. Okay. Actual realities I don't know. So मुझे पता नहीं है ना, तो एक word that I can give you is stress. Is it clear? Okay. Then examples. So reason means stress, like when you have to classify this based on the cause. What is this? Congenital or acquired, communicable or non-communicable? Acquired, non-communicable, 2B, 2B. Okay. And the distribution, stress can be one reason. So maybe like people in the occupations. Okay, work related, something like that you can write. Examples: type 1 disease, type 1 diabetes. Immune system attacks and destroys insulin producing cells in the pancreas, leading to high blood sugar levels. See, you might have heard in the pancreas, we have like beta cells, and in that we have islets of Langerhans, isn't it? Okay. And in that beta cells produce insulin, isn't it? And now look at here, if an antibody attacks on those beta cells died. Okay. Means I am producing antibodies to my own beta cells. So can it lead to diabetes? But this is not the only reason for diabetes. Autoimmune disease is one of the reasons for diabetes. Is it clear? Not the only reason. We have genetic reasons also for it. Habitual also we have. Okay, type 2 diabetes is mostly habitual. Okay, type 1 diabetes also can also be due to genes, genetic reasons. Okay, so one of the reasons is producing antibodies. When we produce, yes, type 1 diabetes can be due to genetic also. Okay, so if you produce antibodies to your own beta cells, then you cannot produce enough insulin. So when there is no enough insulin, insulin work is to control glucose level. So glucose levels will increase. That is nothing but diabetes. Clear for all of you? Can we proceed? Next one, rheumatoid arthritis. Okay. See, at joints, at bone joints, we have a material called as synovial fluid. Synovial fluid, or also known as a synovium. Synovial fluid or synovium. Okay. This is like grease. This is like grease. Okay, just like we put grease in our automobiles, screws and all to reduce the friction. So like that, we have some jelly-like, grease-like material at our joints called synovial fluid. Is it clear? So now look at here. I have synovial fluid here. That is the reason why when I do like this, the two bones are not experiencing friction. So my joints are not getting eroded. Is it clear? See, if they constantly rupture like this, if the joints constantly rupture like this, what happens? They will get eroded. The synovial fluid is preventing that. Is it clear? If there is no synovial fluid, joints will become like this. Whenever we move, the joints will become like this. Then what happens? Wear and tear on the joints. They will get eroded. We get severe joint pains. So if you produce an antibody for your own synovial fluid, is it clear? If I produce antibody to my own synovial fluid, autoimmunity. Okay, synovial fluid is destroyed. There is no grease there. Joint pains. That is called arthritis. But arthritis due to autoimmunity is particularly known as rheumatoid arthritis. Is it clear? Not all arthritis is rheumatoid arthritis. Arthritis because of producing antibodies to synovial fluid. Arthritis because of producing antibodies to one's own synovial fluid is called rheumatoid arthritis. Immune system attacks the synovium, the inner lining of the joints, leading to inflammation and pain of the joints. That is known as rheumatoid arthritis. Okay, autoimmune over. Next, hormonal. Okay, hormonal. It can be diabetes mellitus, insulin hormone imbalance, hyperthyroidism, hypothyroidism, thyroxine hormone imbalance, polycystic ovarian syndromes because of the imbalance of reproductive hormones like estrogens. Estrogen progesterone fluctuation के वजह से polycystic ovarian syndrome is also common. It's a very common syndrome among the females. Polycystic ovarian syndrome, PCOS we say. Okay, many cysts on the ovaries. Is it clear? Many cysts on the ovaries. That is called polycystic ovarian syndrome. They are all examples of hormonal diseases. Hormone imbalance is the cause. Is it clear? Androgens example. Okay, testosterone. Then I know you will ask me, do we have testosterone in the females also? Yes, we have testosterone in the females also, but little amount. Okay. Next, we have infectious or communicable diseases. Infectious or communicable diseases. Okay, here I have given some important examples, some recent examples I have given. First one, SARS, not SARS-CoV-2, inka cousin, SARS virus, original SARS virus. Pathogen SARS-CoV, SARS coronavirus. Okay, country of origin, that is also China. Case fatality rate was 9.6%. 9.6% of the people died because of that. Fatality rate of SARS was more than the fatality rate of SARS-CoV-2. In general, when fatality rate is more, okay, the spread will be less because spread करने से पहले, okay, the host is dying. Is it clear? Then mode of transmission, droplets, etc. Mean incubation period 5 days. Incubation period means after the virus enters into your body, after how many days it will show the symptoms. The time gap between entry of the virus and appearance of the symptoms. Key symptoms are dry cough, fever, diarrhea, etc. Risk groups are people having underlying medical conditions, which we call as comorbidities, isn't it? Treatment, no specific treatment, no specific vaccine. No specific treatment, no specific vaccine. Next one, MERS. Okay, MERS-CoV, country of origin Saudi Arabia, case fatality rate 34.3%. People died due to that. Very high case fatality rate. Mode of transmission, key symptoms, risk group, treatment, vaccine, same thing as a SARS. Clear? Next, we have COVID-19. Okay, so here, this last point you just have to change. Okay, I did not update it. So now we have so many vaccines for it. Okay, so we have so many vaccines. We have Covaxin, we have Covishield, we have Zycov-D, we have Corbevax. Okay, so like that, many new vaccines are also being Sputnik. We have. Okay, and if you are interested, I have taken a special class only on COVID-19 vaccines. You can watch that also. Is it clear? Then, so about this, next, Zika virus. Zika virus disease is caused by virus transmitted primarily by Aedes mosquito. People with Zika virus disease have symptoms including mild fever, skin rash, conjunctivitis. Conjunctivitis means we have conjunctiva here. This is the place we have conjunctiva. So conjunctiva, infection, conjunctivitis. Clear for all of you? Yes. Conjunctivitis, muscle and joint pains, malaise means body pains, headache, etc. These symptoms normally last for 2 to 7 days, but within the 2 to 7 days, the person can die also. Okay. Next, there is specific consensus that Zika virus is a cause of microcephaly and Guillain-Barré syndrome. It means that the mother get infected with Zika virus during pregnancy, the child can be born with microcephaly. Is it clear? If the pregnant lady gets Zika virus infection, the newborn baby can be born with microcephaly and Guillain-Barré syndrome. Links to other neurological complications are also being investigated. It means there is a chance that the baby can be born with more neurological diseases also. Okay. Next, Ebola virus disease. By the way, did you watch my special class on COVID-19 vaccines? In that, I have discussed about Zika virus and Ebola vaccines also. Then please watch it. It is important. Okay. Should I post the link? If you can wait for 2 minutes, I'll post the link here. Because if I say tomorrow, I will forget it again. Wait for 2 minutes. If you want, take a break. Okay, take 2 minutes break. I will post the link. Okay, so that was got it. Okay, so two links I have even pinned it. So that is COVID-19 vaccines class 1 and 2. Okay, and also just 1 second. See, the first two classes are particularly only on COVID-19 vaccines. The third class is current affairs simplified last class. Okay, the like if some of you have attended, that is not a special class. I mean, you can watch it only if you have GS subscription. First two classes are special classes, anybody can watch them. And the first two classes are exclusively on COVID-19 vaccines. The third link that I posted is in general, okay, on current affairs. 3rd January something, the last current affairs class that I have taken. Okay. So if you watched them already, then ignore. If you did not watch them, right? Because in that I covered about Zika virus, Ebola virus vaccines also. Not in the COVID-19 vaccines, second class, I think. Not only COVID-19 vaccines, I also covered about Zika virus, Ebola virus vaccines also. So you can go through that. Okay. So this is Zika virus. There is no scientific, there is scientific census that the children can suffer from microcephaly and other nervous system related diseases. Clear? Less calcium absorption, less calcium absorption during menopause. Which one? Current affairs class, not only COVID, that is miscellaneous, some defense, some space. But in that, I have given about the two new vaccines, that is Corbevax, Covovax, are the two vaccines that got approval. So about that, one of the news item is that. First two classes are particularly on COVID vaccines. The last class is miscellaneous, defense, space, etc. One news item is about the newly approved vaccines in India. Okay. Then this is about Zika virus. Next, Ebola virus. Ebola virus disease, formerly known as Ebola hemorrhagic fever, okay, is a severe, often fatal illness in the humans. Hemorrhage means what? Blood vessels will get ruptured and they can lead to internal bleeding. Clear? Hemorrhage means internal blood vessels can rupture, leading to internal bleeding. Sometimes bleeding from the ears, bleeding from the nose also. Is it clear? If the hemorrhage is severe, they can even bleed from the ears and nose. So Ebola is a severe fatal illness in humans and leads to hemorrhagic fever. The virus is transmitted to people from wild animals and spread in the human populations through human to human contact. The average EBD case fatality is 50% death. The people who get Ebola, half of them can die. And it can even range up to 90% in the places where treatment is not available. Is it clear? Depending on, yes, communicable. Acquired communicable, 2A. All pathogenic diseases. All pathogenic diseases are infectious. All these comes under 2A. And when it comes to distribution, they are more common among the lower socioeconomic strata. Is it clear? Same way I have given about dengue, severe dengue. I hope you can go with that. So what I have done is I have given about few diseases which are recently in the news. SARS, MERS, SARS-CoV-2, Zika, Ebola, dengue, okay, etc. Clear for all of you? You can also read about swine flu. So you can also add about flus like swine flu, bird flu, etc. Plus you can also read about this one, cervical cancer. Cervical cancer, okay. Let me write it. Cervical cancer. This is most common cancer among females, along with breast cancer. Breast cancer is also very common cancer in the females. Is it clear? Yes, all of you? Then it is caused by HPV, human papilloma virus. Human papilloma virus. Okay. Then why means why more common in the females? Because it is a cancer to cervix of uterus. Is it clear? It's a cancer to cervix of the uterus. Cervix means opening. Cervix means opening of the uterus. Is it clear? Opening or neck of the uterus. In general, we say, did you hear about cervical vertebrae? So cervical vertebrae means are they in the uterus? So actually cervix means neck. Cervix means neck. This is like neck of the uterus. So actually we call it as cervix uterine. So uterus cervix, that is opening or neck of the cervix, will get the cancer. That therefore it is more common in the females. Actually possible only in the females. And among females, it's a very common cancer. Possible only in the females, not possible in the males. And among females, it is one of the very common cancer, along with breast cancer. Along with breast cancer does not mean everybody who gets cervical cancer will also get breast cancer. No. Just like breast cancer is a very common cancer, cervical cancer is also a very common cancer. Both are common. Is it clear? It is caused by human papilloma virus. Okay. Reasons can be like unhygienic conditions, and also common among sex workers. Also common among sex workers, and not only need because of that. Okay. In general, because of the unhygienic conditions and lower socioeconomic strata also. Is it clear? This is not a particularly sexually transmitted disease like HIV. But okay, usually maintaining hygienic conditions is not possible for sex workers. That is the reason. That's it. This is not particularly a sexually transmitted disease like HIV. Clear? Unhygienic conditions, poor sanitary conditions, right? Next. So this one is also very important. Okay, kind of in more common in the females category. Next, we have bacterial diseases. Actually, all this is not needed for anthropology. Is it clear? Not needed for anthropology. All these, because you cannot write much of it. But I have given because important for the GS point of view also. Let us do one thing. Okay, fine, let us complete this. These are some bacterial diseases. Can you go through this list? For example, anthrax caused by Bacillus anthracis, right? Just mugging up content. Bubonic plague caused by Yersinia pestis. Cholera caused by Vibrio cholerae. Dental cavities caused by Streptococcus mutans. Lyme disease caused by Borrelia burgdorferi. Tuberculosis caused by Mycobacterium tuberculosis. Are you people in the SNT course? In SNT course, I discussed much more about Mycobacterium tuberculosis. That is also important. TB is very important. Types of TB: multiple drug resistant TB, extreme drug resistant TB, total drug resistant TB. Is it clear? And for anthropology purpose, we don't need all these things. My SNT course, one course was completed very recently, but I'm starting one more course on February 28th. There will be a new course on science and technology on February 28th. Whoever did not attend the course, I advise you strongly to attend the course. Okay, very important. April may be a course hai, February may be a course. There is one course in February also, February 28th. Society course seems like after the prelims only, Chidananda. Okay, because I still did not get any clarity on that. I discussed with the team, but I still did not get clarity about when I can launch the course. Any course is okay, like any science and technology course is okay. Like in any course, I will do the current affairs till that date. But after that, whatever current affairs comes, you have to keep going through the newspapers and all that. Okay, comprehensive. My all science and technology courses are comprehensive only. You can go with February course, April course, and usually later course means like more current affairs will be covered. So that is there. But after April also, you have to go through the current affairs again. You have to continue. Okay, next. So any science and technology course I take up, I will update it to that particular date. Okay. After that, whatever developments happens, you have to go through that. Society GS paper 1. Basic science will be there before the prelims. I'll do it in the month of March. Basic science NCERT course 100% will be there before the prelims. I'll do it in the month of March. Fine. Can we proceed? But this is not very important for anthropology. This I have given keeping GS in the mind. Next we have, okay, prion-induced diseases. Okay, prion means what? Okay, let me give you this classification also. Like, say for example, if you take virus, what is a virus? Virus is either RNA or DNA, right? Either RNA or DNA packed inside a protein coat, isn't it? Packed inside a protein coat. So a virus will have two components, RNA or DNA plus protein coat. That's it. No cell. Is it clear? Acellular. There is no cell at all. Is it clear? Next level we have bacteria. Bacteria. Bacteria are unicellular. Unicellular. These are, okay, acellular. Is it clear? No cell. Acellular. And okay, threshold between life and non-living. Is it clear? Threshold between living and non-living. Okay, means inside a host cell they are living, they can replicate, but outside a host cell they cannot replicate. SARS-CoV-2 cannot replicate on the surfaces, it can replicate in our tissues. So inside our body it is living, outside our body it is non-living. Okay, and there is no cell. Whereas bacteria, unicellular, and it is clearly living. Okay, but this is prokaryotic. Prokaryotic means there will be a cell, okay, but just DNA at the center. Is it clear? There is no nucleus. Is it clear? Prokaryotic means there is no nucleus. No nucleus. Examples, all these are the examples of bacteria. Is it clear? All these are the examples of bacteria. Virus examples, all these are the examples of viruses. Clear for all of you? What is virus, what is bacteria, and examples are covered. Okay. Then after that you have protozoa. After that we have protozoa. Protozoa are also unicellular, one cell only, like bacteria only. Okay, they are also living obviously, but they are eukaryotic. They are eukaryotic. Means there will be a cell and there is a nucleus inside. And inside the nucleus you have chromosomes. Is it clear? Inside the nucleus you have chromosomes. Example, yes, amoeba, then plasmodium. Plasmodium falciparum that we studied, protozoa, that's a protozoa. Is it clear? Then after that we have fungi. Fungi, they are multicellular. And of course eukaryotic. Eukaryotic. Is it clear? Then, so do you agree they are in the increasing complexity? Most simple virus, इससे complicated bacteria, इससे भी complicated protozoa, इससे भी और भी complicated बड़ा organism, that is fungi, multicellular. And now if you observe, I kept a slot vacant here. Okay, that is prions. Okay, prions. These we can say simplest okay pathogens. Virus से भी simple. Okay, just a free living protein that can cause disease. Is it clear? Just a free living protein. It means we can say virus minus DNA or RNA is prion. Is it clear? In the virus you have protein plus nucleic acid is there. In the prion you don't have nucleic acid, only protein. Is it clear for all of you? Just protein, a free living protein that can cause disease. You're asking me what? Only a protein that can cause disease is a prion. Are you all following? What disease I will tell you? Kuch to disease. A free living protein that can cause disease is called prion. Okay. Then now prion induced diseases examples. Just like Jarvis is asking which disease, they can cause Alpers disease, bovine spongiform encephalitis. Bovine means what? Cattle, buffalo, cow, etc. Is it clear? Viron is also like virus only, little smaller virus that will also have DNA or RNA. Genetic material will be there in virion also. Okay, prion is the most simplest. So bovine means cattle, buffalo, cow, etc. Encephalitis, you know, cephalic means head. Encephalopathy means what? Something related to brain. Spongiform means, okay, if a person gets this disease, the brain will become like sponge and inevitable death, sure shot death. Is it clear? A very dangerous disease. It's a fatal neurodegenerative disease of cattle that is transmitted to human beings who eat infected carcasses. Okay, beef consumption particularly. Okay, like when they eat the carcasses of the dead cattle. Okay, then there is a chance that humans also can get this. What causes this disease? It's a prion. What is a prion? It's simple than virus. Virus se bhi chota. Okay, so we don't know anything about it. There is no medicine for it. There is no vaccine for it. Is it clear? Uncurable, fatal. One more such disease is Kuru, characterized by headache, joint pain, shaking of the limbs, affects brain, and it is also fatal. These are the three examples of the diseases caused by prions. Clear for all of you? Alpers syndrome, bovine spongiform encephalitis, Kuru are the examples of the diseases caused by prions. SARS, MERS, SARS-CoV-2, Zika, Ebola, Dengue, Chikungunya, all these are the examples caused by viruses. Anthrax, Mycobacterium, tuberculosis, cholera, etc. They are the diseases caused by bacteria. Is it clear? Amoebiosis and malaria, okay, they are caused by Plasmodium and Entamoeba histolytica, that is protozoa. Okay, and so now viral prion induced over, viral over, bacterial over, protozoal over. Is it clear? No treatment, no treatment. See, the simplest they are, most difficult to cure. Is it clear? Virus itna chota hai and it is threatening the world. A terrorist also should get afraid of this COVID-19. Isn't it? Sabse chota hai, so that is the advantage. So simplest thing, okay, is the most difficult to cure. Very rare. Did you hear? You did not even hear about it, right? Prion induced diseases kabhi suna bhi nahi hai na, so very rare. Very rare. Okay, luckily prion induced diseases are very, very rare. Usually any highly fatal disease is very rare. This is natural selection. Any disease is widely spreading means it is less fatal. For example, when compared to Delta, Omicron was more transmissible, so it is less fatal. More transmissible diseases are less fatal. More fatal diseases are less transmissible. This is rule. Okay, natural selection. Can we proceed? So prion over, virus over, bacteria over, protozoa over. Now let us see toxin-mediated diseases. Toxin-mediated diseases means actually caused by bacteria, पर बीच में एक toxin है. Is it clear? बीच में एक toxin है, mediated by toxin. Toxin means poison. Example, diphtheria. Caused by bacteria. This is you can write it under bacterial disease also. Corynebacterium diphtheriae. Okay, but the bacteria do not cause symptoms. It will release a poison, toxin, okay, which inhibits protein synthesis and damages respiratory system, heart and nervous system. It means Corynebacterium diphtheria is not causing the symptoms, but this bacteria will release a toxin. The toxin will cause the symptoms. So this is a toxin-mediated disease. Is it clear? But of course, you can write it under bacterial also because it is basically a bacteria. Can we proceed? By the way, okay, I will repeat, but before I repeat, one small point. Using this data for anthropology is quite simple because we don't have multiple choice. Kind of, say for example, okay, bovine spongiform encephalitis, lengthy dikh raha na, cut kar lo, don't remember. Alpers, acha hai, sound acha hai, yaad rakho. That's it. You don't have multiple choice question. You need one or two examples. Okay, bacteria. Okay, Borrelia burgdorferi something. Okay, not sounding good. Leave it. Anthrax, Bacillus anthracis, sound acha hai, yaad rakho. Is it clear? For anthropology, going through this content is quite easy. Is it clear? Okay. Then why I am giving so much of, see, you cannot even write this much. One example, only this is enough for you. Is it clear? Okay. Or maybe like only this is enough. One example for virus. One example, you cannot write more than that. You cannot write more than one or two examples for each category. Is it clear? Rheumatoid arthritis, complex word here in this one. Okay. Autoimmune rheumatoid arthritis, not good. Type 1 diabetes mellitus, write it. इससे भी easy चाहिए तो premature menopause. Premature menopause. It means what? Interesting. A woman releases antibodies to her own egg cells. Is it clear? A woman releases antibodies to her own egg cells. So her body is destroying her own egg cells. So eggs खत्म है, menopause आ गया. ठीक है? Clear for all of you? Eggs are all destroyed. No more eggs to release. So no more periods, no more menstruation, menopause. That is premature men. A 30-year-old lady getting menopause, a 25-year-old girl getting menopause. Clear? That is premature menopause. So for anthropology, using this content is quite easy because you don't have multiple choice. Whatever you like, you can remember. Is it clear? But why I have given so many examples? Because you can choose whatever is easy for you, whatever is more familiar to you. Plus, as I told you, this is important for GS also. So keeping GS paper also in the mind, I'm giving you this content. Only for optional, you don't have to remember this much content. Is it clear? Understood how to write? Of course, we will discuss questions also. Okay. Toxin mediated. One more example, cholera. Vibrio cholera. It's a bacterial disease, but Vibrio cholera will not directly cause the symptoms. It will release a toxin. Okay, that toxin is responsible for symptoms. Which में एक toxin है. So toxin mediated disease. Same way whooping cough caused by Bordetella pertussis. Tetanus caused by Clostridium tetani. All these are bacterial diseases also. Is it clear? But the bacteria are not the actual disease causing things. They release a poison. The poison causes the symptoms. Are you all following? Any doubts still here? Next. Okay. So with this we completed distribution, and with this we also completed causes also, isn't it? Distribution is over, determinants is over. So it means most of the epidemiological anthropology is completed. If you just observe the slides number also, more than 50% of our 9.8 is completed. Okay. So now let us see some case studies. Some case studies. Okay. The case studies are interesting and also familiar to you. Ashkenazi Jewish genetic diseases, simple inbreeding concept. There are some genetic diseases which are more common among Ashkenazi Jewish people. Is it clear? Just like founder effect inbreeding, that concept only. There are a group of rare disorders, means normally, just like Ellis-Van Creveld syndrome, normally it is rare. I have never seen a patient suffering from Ellis-Van Creveld syndrome. But if you see in the Amish group, they are more common. Same way here also. There are some genetic diseases, normally they are very rare. But Ashkenazi Jewish people, they are very common by inbreeding. Coincidentally, some of these people had the disease. Then they went on inbreeding. So that disease became very common among them. Clear for all of you? Fast, please. If you are fast, we can cut short one more class also. Already we have one class in advance, and if you are fast, we can cut short one more class. I didn't think anything like that, but if you want, I can take, no problem. Okay, so Ashkenazi Jewish, first 7:30 तक तो सुन लो, बाद में देखेंगे. Okay, so Ashkenazi Jewish genetic diseases. Okay, 7:30. I will leave you at 7:30. Let us complete this. Okay. So did you understand this Ashkenazi Jewish genetic diseases concept? Just like the total rod cell color blindness, Ellis-Van Creveld syndrome, epicanthic fold among, why epicanthic fold is more common among Mongoloid people? Same, similar logic. They are a group of rare disorders that occur more often in the people of Eastern Europe, that is Ashkenazi Jewish heritage, than in the general population due to inbreeding among them. Then what are they? Okay. Even though most of these diseases are severe, can cause early death, some of them can be treated to reduce symptoms and prolong life. Some of these diseases can be diagnosed during pregnancy through chorionic villi sampling and amniocentesis. This testing is done usually if one or both parents have this disease. Is it clear? If any one of them are carriers, then do this testing. If any one of the parents have a family history of these genetic diseases, then they can go for this prenatal diagnosis. Clear for all of you? Next. Okay, diseases of this example, it means Ashkenazi Jewish genetic diseases. Bloom syndrome. Bloom syndrome babies with these diseases are born with small, the babies are born small, means less birth weight, small size baby born. And also they remain shorter than normal as they grow. When they grow also, they do not grow normally. They remain shorter, smaller. Okay. Their skin may look red and they have more lung and ear infections than children normally have. These are the symptoms of Bloom syndrome. Is it clear? Symptoms of Bloom syndrome. And Bloom syndrome is one of the diseases common among Ashkenazi Jewish people, but rare in the general population. Did you see any patients suffering from Bloom syndrome? Or you know anybody having this syndrome? So in the general population, it is rare. But among Ashkenazi Jewish people, it is more common by inbreeding. Coincidentally, some of them had it, and inbreeding increased the percentage frequency. I repeat, coincidentally, some of them had it, and inbreeding increased the numbers. Yes? Cystic fibrosis, you know this. This disease causes very thick mucus in the lungs and problems with respiration and digestion. Thick mucus in the lungs and respiratory system, problems in digestion and respiration. Clear? Cystic fibrosis is also rare among general population, but common among Ashkenazi Jewish people. Why? Probably, okay, people having this disease, coincidentally people having this disease are there in that population, and inbreeding increased the numbers. Clear for all of you? Fine. Then when anyhow we cannot complete it today, so I'm stopping this here today because anyhow we completed more than 50% of it. Okay. In the next class, we will be both completing the epidemiological anthropology plus I will also give you the introduction for unit 6. Is it clear? Monday, we will complete 9.8. That means we will complete total unit 9. And also I will give you the introduction for unit 6, that is theories. And the class is completed. Those who don't have any doubts can leave the live. So for those who are leaving the live, thank you so much for your active participation. Good night. And if you have any doubts, you can ask me now. All your controls are off. You can use them, like raise the hand, ask a doubt, anything. Yes, physics, chemistry, biology, all I will cover. Nutritional deficiency disease come under congenital, no need. Okay, after birth also it is possible. Okay, means it can be congenital, but usually it is acquired. Patau's and Down syndrome are detected using satellite chromosome because 13, 14, 15, 21, 22 chromosomes have satellite. So it means normally we have 10 satellite chromosomes, 5 pairs. If you have 11th satellite chromosome, it means it can be Downs or Patau's. Shani, clear? Very good. Any more doubts? I didn't understand the question, Farha. I'm sorry. Yes, any doubts? जिनको menstruation कभी आया ही नहीं उन्हें कौन सी problem होती है? So we have unit 11 Farha, that is about fertility and demography. In that we will discuss in detail about all these factors. Go through the syllabus in unit 11. Okay, menarche, menopause, and other biofactors related to fertility. We have a topic. In that I will explain all those things. Right?